Delirium is a very common manifestation, especially during hospitalization for patients. Depending on the setting that the patient is in and the type of medical condition that they're admitted with, delirium can be as high as 80%. We see these very high percentiles in our patients that are in the intensive care units, medical and surgical ICUs. It's also a very common occurrence in our surgical patients, specifically post-orthopedic surgery and post-cardiac surgery. They seem to have an extremely high incidence of delirium. And then the remainder of hospitalized patients also have an ability to become delirious. There are different forms of delirium. There's hyperactive delirium, hypoactive delirium, and mixed delirium. Hyperactive delirium is very hard to miss as a clinician because these are the patients that will be swinging from the bed rails, yelling, screaming, accusing people of stealing things, trying to constantly get out of bed. So they display very agitated behaviors. Then we have hypoactive delirium, which, again, this is the most common type of delirium that is missed because the patient can be a very quiet patient. This patient can be the perfect patient. They could be sitting there and the nurse comes in and says, "So, how are you today?" "Fine." "Do you need anything?" "No." The issue is that they never speak because they don't know what's going on and they don't want anybody to know that. So often these patients are actually dismissed as normal mental status because no one has actually tested them to see what their attention span is. So this is where we miss these patients that are hypoactive. Also, then there's the obviously hypoactive patient who is having trouble staying awake while you're talking to them. They're falling asleep while they're eating their dinner. Again, these patients are often misdiagnosed because nurses will describe them as lethargic, but they won't make the connection that the lethargy is actually a change in mental status, is displaying disorganized thinking, inattention, and a change in level of consciousness, which are often consistent with a delirious condition. And then lastly, we have the patient that has what we call a mixed delirium, and these patients will fluctuate minute to minute, hour to hour, shift to shift between hyperactive states, hypoactive states, and normal mental status. Individuals that are at high risk for developing delirium. First, we can talk about age, and the older a patient is, the higher their risk for delirium. A second high risk factor would be any sensory deficit, and that could include vision loss or hearing loss, which are the most common sensory losses, particularly in older adults. A third population of patients that are high risk for delirium is anyone that has a pre-existing dementia or pre-existing cognitive impairment. These patients, delirium can be as high as 90% when they are hospitalized or when they become ill. And actually delirium is often the first sign of acute illness in a patient with a baseline cognitive impairment. A fourth risk factor for delirium would be having a history of delirium on previous admissions to the hospital or previous illnesses. We find that once a patient reacts in a delirious way to illness, it seems to repeat itself in future events. And a fifth category would be anyone that might be dependent on a substance, and that could be either alcohol or it could be other medications or drugs that specifically cannot be withdrawn abruptly. And sometimes patients are hospitalized and we inadvertently withdraw them from these substances either because we didn't know that they were dependent on them or because we feel that it's not in their best interest to take these substances. And with several studies, it was found that there were 4 key elements that could be assessed that would give you an accurate diagnosis of delirium. And those are the 4 criteria that we see in our confusion assessment algorithm. And those would be, again, a change from the patient's baseline mental status or a fluctuation in mental status. Secondly, evidence of inattention. The third component is elements of disorganized thinking. And lastly, an altered level of consciousness.